Hey guys, so in this video I wanted to respond to a comment that was recently left on one of my videos. And this comment was left by Joanna. She basically asked if being a medical assistant was easier than being a CNA. So for those of you who don't know, I currently work as both a medical assistant and a sleep tech. So I work full-time as a sleep tech currently, and then I basically pick up shifts or work as needed as a medical assistant whenever I have the availability or am not working in the sleep center. So to answer your question, I think yes and no. So there are certain ways that I would say being a medical assistant is easier, quote unquote, than being a CNA. And that would definitely be in a physical aspect, because I do think that being a CNA caused me a lot of physical problems with my chronic illnesses and things like that. I also kind of started off with a disadvantage in that aspect, but I do feel like working as a CNA and doing those sorts of repetitive physical motions and tasks, like my back has been screwed up since I started working as a CNA in 2016. Within maybe 6 months of getting certified, I injured my back because nobody would come help me while I was working on the trach unit. And so, yeah, it was a mess. But basically, I would say physically working as a medical assistant is definitely easier than working as a CNA. I do think there is more like medical knowledge that you need to have in order to work as a medical assistant compared to a CNA. And I don't mean that as a dig towards anybody who works as a CNA, because I feel like it's a totally different skill set compared to medical assisting or nursing or any other healthcare position. But I definitely feel like it's important to realize that there's going to be difficulties with any position, especially when you're dealing with people, because having to interact with the general public, you have to learn how to handle different attitudes, different personalities, different issues, and things like that. There are certain things I feel like medical assisting it can be chaotic and it can be busy, but the chaos of a nursing home is way different than the chaos of working as a medical assistant in a clinic setting, because you're not, like, most of the time as medical assistants, we are not expected to transfer these patients. I can count on my hand the number of times that I've had to help people like get into a wheelchair or out of a wheelchair, or like help them transfer into their vehicle, because it's just not one of the skills that we do. I mean, working in an outpatient setting, most of the people that come in that need that type of assistance, they have either a caregiver or a family member who is coming with them that usually helps them with that. So we don't really even have to do things like that. So I would say physically it is definitely easier than being a CNA, but I can't really say that one is more difficult than the other, if I'm being honest, other than physically. I feel like the difficulty level is the same if you take out the physical aspect. And like I said, once you become used to giving all the injections and giving medications and things like that that you might be required to do as a medical assistant in a clinic setting, or helping the provider do different procedures and things like that, like a lot of times with me, when I'm working with a provider, I will end up doing or helping with joint injections, and sometimes helping with like Nexplanon implants and things like that. I can do like a depot shot by myself, but like the Nexplanon implants, those are obviously something different. So an actual provider needs to do that. So I can get everything set up, do the pregnancy test and all of that stuff with the patient before the provider comes in, and then I assist the provider as he or she is doing the actual procedure. It's like I said, it's a different knowledge that you just have to learn and become used to, compared to dealing with, stuff in a nursing home, transferring changing briefs, showering, toileting, all of that stuff. It's a totally different knowledge base and skill set. But like I said, I wouldn't necessarily say that one is more difficult than the other if you take out that physical aspect. Which is kind of why I changed from CNA to medical assistant, because I couldn't, like, physically, with the health problems that I was dealing with, I could not physically handle doing CNA work anymore. My back was so screwed up that I just couldn't handle it. There was too much pain and it was just too much for my body to handle. And I've still got medical issues, obviously, that I do have chronic illnesses. So, you know, like, I had to do what was best for me and switch from CNA to medical assistant. And I feel like that was a good decision. And, you know, working as a sleep tech is even more sedentary. Not that I necessarily would like or prefer a sedentary job, because I do like getting up and being on the go and kind of, you know, it does make the day go by faster. But obviously, like a sleep tech position, I'm sitting at the computer, I'm watching the sleep study. Other than like hooking the patient up at the beginning of the study or before the study starts, I'm not really doing a whole lot unless they need something, you know, like unless I have to go into the room for some reason, I'm sitting at the desk and watching their brainwaves on the computer for 12 hours. So, anyways, I hope that answered your question. I know I probably got off track a few times there, but if you guys have any more questions or would like to hear my thoughts on any other topics, let me know. And yeah, let me know what kind of videos you guys would like from me in the future, and I will try my best to get those filmed for you. And with that being said, I will talk to you guys next time.